exercise is very important in the management of people with Parkinson's disease. And, over the last couple of decades, we've had a surge in the number of studies that have examined the benefits of exercise in people with Parkinson's. And, the trials have become larger, they've become more rigorous, and particularly in the last couple of years, we've had some very large, phase 2 trials. In fact, there's a phase 3 trial in the works right now. And so, for the last several decades, there's been lots of data in animal models suggesting a potential neuroprotective effect of exercise. It's in humans, it's difficult to know for sure because we don't have a biomarker, in which we could measure the changes, in disease progression exactly. However, there's more and more evidence, even in humans with Parkinson's disease, about the benefits of exercise. We've seen various changes using fMRI and PET scan, for example, but mostly in the trials, we use behavioral measures, and the sort of gold standard behavioral measure in people with Parkinson's is the Motor Unified Parkinson's Disease Rating Scale. And so, 2 large studies that have been done in the last couple of years, the SPARKS-2 trial and the Park and Shape trial, so both with about 130 patients with Parkinson's disease. The SPARKS trial was de novo, so very early people with PD, and the Park and Shape trial was done, in people early on, although they were medicated. But in both trials, they looked at the benefits of aerobic training. And this sort of mirrors, most of the animal studies looked at the benefits of aerobic training. So in these human studies, both in the SPARKS trial, looking at aerobic training on a treadmill, and the Park and Shape trial, looking at aerobic training on a cycling, a stationary bike, showed a slowing in the progression of Parkinson's disease as measured by the motor UPDRS score. So both of them were over like a 6-month period. The SPARKS study showed a reduction or, 3 points or so, less decline in the UPDRS motor. And the Park and Shape trial showed a change in about 4.5 points, so a slowing of about 4.5 points in the motor UPDRS. Both of those are clinically meaningful changes. And so in both studies, the level of aerobic exercise was high intensity. 70 to 80%, heart rate max. So patients were, engaged in exercise. They ended up exercising about 3 days a week for 30 minutes in that target heart rate range over 6 months. So this is exciting. This shows changes that could be interpreted as disease mitigating, although we need more data. And in the SPARKS-3 trial, which will be, the PI is Daniel Korkos out of Northwestern. He's going to be leading this large phase 3 trial. It's many centers, more than 25 centers in the U.S. and Canada. It'll be about 350 or so patients with Parkinson's disease in the early phases. So it's very exciting, and it's exciting to see larger, more rigorous studies in this area.